So I want to show you guys where we process our instruments. It's very important when we do surgery that we have a good place to properly take care of our instruments, because many things are reused and they need to be properly sterilized and cleaned. So I'll show you the steps that it takes to do all this type of cleaning. First, you have this dirty sink area, and this is where the instruments first go. And there's an enzymatic solution that breaks down the various types of blood components and different things that could be on the instruments after use. So there's the dirty sink area, and then we have this clean sink area. In some places, they use like wooden cabinetry for this portion. I prefer stainless steel. It's much easier to clean. It's very important that you can properly scrub down the area after use so that it could be clean for the next time we need to use it, which is usually the following day. This little thing here is used for spore testing. So you have to make sure that the autoclaves are not growing different types of fungus, for example, that could potentially infect the instruments. Then instruments can get dirty, and then those instruments, if used on another person, you can transmit different types of infections. So spore testing weekly is very important. And then we have here an area where we package the instruments once they're fully cleaned up. And then here we have these two autoclaves. Now, autoclaves are set to a very high temperature, and essentially you're kind of like steaming these instruments at a high enough temperature to get rid of all the different, microbes, bacteria, all these different things that can be on the instruments. So inside, things kind of look like this inside, and you have to make sure your water levels at a certain point, and these machines get properly processed every few months. We have someone come in, they make sure that it works properly, that everything is functioning according to the standards and protocols that are expected of a surgical facility. That's some of the basics of our sterilization room. We make sure that all of this is done at a very high level, because that's what patients deserve for proper safety. So hopefully learn something. Give us a thumbs up and let us know in the comments below if you have any questions about this process when it comes to sterilization of instruments, how we do it, why we do it. We'd love to hear from you.